one of the biggest problems that I've dealt with in my office is clenching and grinding. We're really not taught in schools that it's that big of an issue or problem. But the way we treat people in this office is that there are basically three things that tear teeth up. One is cavities, two is gum disease, and the third is clenching and grinding. And in reality, clenching and grinding account for about a third of what we do in this office. And so we try to address that, and we treat it. We try to treat it with bite guard therapy. Some people can or cannot wear a bite guard. They won't do it, or they can't do it. They'll wake up with it in the middle of the bed at night. And so Botox simply offers an alternative. We can use Botox in place of a bite guard and just take away the grinding completely. And for those people, it's a big deal, and it's a really good alternative. One of the things that we found out with Botox therapy is that when muscles are not used, they tend to atrophy. And when muscles get smaller, they're not as strong. And not only that, but there are things in muscles called engrams, which is what we call muscle memory. That muscle memory is forgotten. And so there have been cases where people have been Botoxed and used Botox therapy long enough that their muscles actually shrink, they lose their memory, and they forget how to grind. And that's exciting. We've not ever seen that. We've never had this kind of treatment for patients who suffer with chronic pain like that before until Botox. So that's how I originally got started with it, and it was great. And so people found out I'm doing Botox, they go, well, can you do maybe a little right here, right around? I say, well, sure, because who's better at giving injections than dentists? We give more injections than any healthcare provider, so we're good at that. And so a lot of times patients will come in, they get their teeth cleaned, and if we know ahead of time, then we can go ahead and set up for Botox injections also.